active ingredients in many of the supermarket shelf oral products like toothpaste and mouthwash, we don't know what they do to the majority of the microbiome. And to put it in perspective for the mouth, we don't even know half of the species. And you've brought up a great point there, is that there's more than bacteria. There's fungi, there's archaea, there's all types of microbes living in the mouth that we don't even know. And so there are effects to the microbiome that we really should be thinking about. And when you put a product in your mouth that says it's antibacterial, you should really be thinking about, is this the way for me to develop long-term a diverse and strong oral microbiome? Because that's the way we protect disease in the long term. And so there was a study last year that showed that people that use alcoholic mouthwashes increase their risk for pre-diabetes. And I think that was one of the first that really showed the oral and gut connection between when we lose diversity in the mouth, that translates to the rest of the body. So I don't tell my patients to use antibacterials every day because of this perspective. We need to shift this idea that we need to kill bacteria.
Well, there's an interesting study that was just published recently suggesting that antibiotics change the microbiome of the mouth and kill off some of the good bacteria and microbes in the mouth that may be protecting us from cavities and other problems. Any thoughts about antibiotics? We never even imagined such a thing.
Absolutely. And unfortunately, when we go to the dentist for a dental infection, there's one of the most common ways to deal with it is to prescribe antibiotics. So there are certainly species that protect us against tooth decay and gum disease. We know this. There is research on the oral microbiome showing us this. And so when we do take an antibiotic, we really, if you do have to take one, if there is a condition where you do have to treat it with antibiotics, you should be thinking about the path after, the months where you're re-establishing that relationship with those microbes to heal yourself. And that the biggest connection to that really is food.
You're listening to Dr. Stephen Lin. He's author of The Dental Diet, the surprising link between your teeth, real food, and life-changing natural health. As you can tell, Dr. Lin practices integrative dentistry in Australia. For this book, he combines insights from anthropology, physiology, and nutrition with classic dentistry. Dr. Lin calls himself a dental nutritionist. It's surprising that the field of dentistry has not paid more attention to the impact of the food we eat.
After the break, why has so little attention been paid to mouth health in relationship to overall health?
Researchers have identified links from gum disease to heart attacks and type 2 diabetes.
Some people have dental phobia. What can be done for that?
How can we start children out with the best chances for healthy teeth and gums?
We'll also learn about the basics of the dental diet.
You're listening to The People's Pharmacy with Joe and Terry Graydon. This podcast is brought to you by the Verrazana Health Club. This comprehensive home testing service enables you to track crucial health markers of gut health, inflammation, metabolism, hormones, thyroid function, and many other organ systems. Regular testing can help detect health imbalances before they lead to sickness. Online at Verrazana, verizana.com/health-club. Get 50% off the first month with the discount code PEOPLE50. Welcome back to the People's Pharmacy. I'm Terry Graydon.
And I'm Joe Graydon.
The People's Pharmacy is brought to you in part by CocoVia Memory Plus, a cocoflavanol supplement backed by 4 clinical studies that show significant improvement in 3 different aspects of memory. More information at cocovia.com.
Also by Verrazana, an analytical laboratory providing home health tests for hormones, gut health, and the microbiome. Now with an annual health club plan. Online at verisana.com/health-club.
And by Kaya Biotics. These hypoallergenic probiotic products are made in Germany from certified organic ingredients. Online at kayabiotics.com.
Today, we're talking about the relationship between our diet and our oral health.
When was the last time you visited a dentist? Many people have put off visits to the dentist because of their concerns about COVID-19. But that doesn't mean you should ignore your dental health. It's more important than ever to brush and floss. And what you should do is check with the dentist's office to see what precautions they're taking to prevent infection. You'll want to be especially thoughtful about your diet. Snacking on high-carb foods and sugary treats is problematic if you're not seeing your dentist on a regular basis. What foods should you be including in your diet, and what should you ignore?
Our guest is Dr. Stephen Lin. He is a board-accredited dentist, TEDx speaker, and author of The Dental Diet, the surprising link between your teeth, real food, and life-changing natural health. Dr. Lin's book contains lots of recipes and meal plans to prevent many of the problems he sees in his dental practice.
Dr. Lin, in the foreword to your book, The Dental Diet, Dr. Mark Hyman says that the health profession has long understood the links between gum disease and heart disease and type 2 diabetes, including the fact that diseases that originate in the mouth have consequences for the whole body. But the healthcare profession has failed to use this valuable piece of the puzzle to help shape our overall health. Do you have any idea why this might be?
Yeah, Terry, this very topic was one that brought me into this idea that the mouth was a powerful tool that we are missing, in that a patient of mine, he came to me with a letter from his cardiologist. He was scheduled for quadruple bypass heart surgery, and he needed a dental clearance before he went into the hospital to get this surgery. And I looked at his mouth, and he had severe periodontitis, which is gum disease. And I had to remove the last of his teeth before he went into surgery. Now, he didn't make it through the surgery process. He died a few months later, and that really made me start to think, why do we leave this so late, where we send a patient with a chronically inflamed mouth to a dentist to try and treat the problem that has been bubbling along for years? Had I seen the patient earlier, we would have been able to work with this. And what the literature has shown is that there is a relationship between heart attacks and gum disease, and type 2 diabetes and the gum disease, and that it really sits in this profile of chronic disease conditions that we really we know there's a relationship, but we don't know what the mechanism was. And I think the mechanisms have been, for instance, we've focused too much on acute infection, so the connection to pericarditis. And so what we now know is there is a connection between the oral microbiome and the gut microbiome. There is a connection between nutrient deficiencies and gum disease, and that the mouth is the first sign of these chronic inflammation processes that cause diseases over long periods. So when you have bleeding gums, you should be thinking, okay, my body's telling me that I'm a little bit out of balance and that I should be looking at my mouth as a sign of the health of the rest of the body.
Well, that's a really dramatic case. I can imagine that the cardiologist and the heart surgeon were thinking, boy, we better get his teeth under control before we, undertake this bypass surgery. But, I'm guessing this was a person who didn't go to the dentist that often, or else it wouldn't have gotten so bad. I have a good friend, very smart person, very highly educated, very capable on all fronts, but he has an absolute phobia about going to the dentist. Maybe he had a problem when he was young, but whatever it is, he delays until he absolutely has to go to the dentist. And even then, he basically goes under protest and sort of asks them, well, can you anesthetize me so that I don't experience or feel anything? I don't know if you have those kinds of cases in Australia, but I suspect that it's not that uncommon, that a lot of people fear the dentist, and then their mouth gets into pretty bad shape. What do you recommend for somebody like that?
I absolutely see this every day, and it's amazing how we've developed this societal problem between a fear of the dentist, both of whether it's anxiety-based, around the pain of an experience with a dental appointment, or whether it's been, for instance, a socioeconomic disparity between where we can't afford to go to the dentist. There are so many barriers to improving our oral health. This is something we need to think about very much in terms of we are missing a big piece of investing into our health future. And so I would really recommend someone that has dental anxiety in this form to go and have a discussion with the staff, with the practitioner, where there's no instruments. Many dental practitioners understand this. We see it every day, and that you are really investing into your future. And that first conversation can really be, that open doorway to really improving your health long term.
When we talk about starting to improve your health long term, I'm thinking about really going to the very beginning. So I'm thinking about a baby who is teething. What can parents do to encourage good dental health in a toddler?
So for toddlers, this is a crucial stage for their development, and this happens right throughout a child's life up until they're 12. But right from the beginning, breastfeeding is the first way that we feed a young developing child the nutrients for a healthy mouth and healthy teeth. And so, for instance, the vitamin D levels of the mother and the child are crucial to how their skeletal system and that immune system that protects them against tooth decay. And so I would always encourage a mother to understand her own gut health and her own nutrient levels as a way to pass this on to their child. And so for a toddler who is starting to teeth and starting to chew things, chewing is actually a nutrient that helps develop the jaws. So we should be encouraging our children after 6 months to start to use their jaw. It's a musculoskeletal joint. And so those exercising via food really does help to send those physical messages to place bone and to grow strong bone where teeth are going to eventually be. And lastly is breathing. Breathing is very important for the oral environment, and nasal breathing is very important. So a child should never be open mouth posture, and that's something that we really should be checking from a very early age, where we can teach kids to breathe through their nose, and that can actually help develop their palate via nasal breathing. And so that will decrease their risk of braces later in life.
Dr. Lin, when I think of children, young kids, teenagers, and of course older adults, I think of the kind of food that we're eating today. I mean, let's face it, the industrialized food system has come up with a lot of fast food. I mean, teenagers love pizza, and there's all kinds of snack food. And we've heard a lot about the impact of such carbs and food on heart health, for example, and overweight and obesity and diabetes. But I'm wondering about how it affects our teeth. And we were told as kids, sugar's bad for your teeth, it'll cause cavities. But I'm guessing that a lot of our fast food today is just as bad.
Yeah, you're absolutely right. And there's three main culprits I think we've put into our modern diet, into our fast foods that really do cause the problems we see in the mouth and the rest of the body. And I think that's sugar. That's one that we've really, we've known for a long time causes dental problems. But, telling people to stop eating sugar is a difficult message on its own. And I think the reason is because there's more to it. And so you mentioned refined carbohydrates. And so refined flour behaves very similarly to sugars in the body. And so these kind of foods, you mentioned a pizza, so a white flour-based pizza will deliver a sugar-based effect to both the mouth and the gut. And so we need to be thinking in this way of our delivery of these refined carbohydrates. But last